So this is our deep dive on premature ejaculation. What is it, what causes it, and what are the top 5 ways we can treat it? So if you found this video helpful, hit that like button, subscribe, and hit that notification bell so you know when we drop our next video. Okay, just kidding. Let's dive in today and talk about what it means to finish sooner than you'd like to as a guy in the bedroom and what we can do about it. I'm Kristen Gumpf, men's health PA and dedicated sexual medicine specialist, and today I'm giving you 5 ways to slow things down and enjoy sex longer. Plus, stick around to the end for a bonus tip. Premature ejaculation, also known as PE, is actually the most common problem that men can face in the bedroom. Believe it or not, most studies show that PE is more common than ED or Peyronie's disease. Sure, we make the occasional joke, and to be honest, you have to when you work in urology and sex med, but it really can be devastating for men who suffer from it. Premature ejaculation affects up to 30% of guys, and honestly speaking, most men will report experiencing it at some point in their lives. PE is classically defined as poor ejaculatory control and climax within 2 minutes following penetration. Compare this to average time that most men last during penetration of only 5 to 6 minutes. Yeah, don't believe what you see in the movies, or the movies. PE falls into 2 major categories. It can either be lifelong or acquired, meaning that the symptoms that a guy is experiencing are a marked change from his usual baseline. This commonly presents following a major life event, but it doesn't have to. Regardless of which type of PE a guy has, our treatment choices are pretty similar, so let's get into it. Here are top 5 ways to beat PE and last longer when it counts. Number 1 is sex therapy and specific bedroom techniques. Along the same lines, I would always encourage open and honest communication with your partner. This tends to solve a lot of problems. The American Urologic Association, aka the governing body over all urologists, recommends patients with PE seriously consider discussing their problems with a sex therapist. This isn't a doctor or even a PA like myself. This is a trained mental health professional who specializes in sex. If you want to find a certified sex therapist near you, check out the American Association of Sexuality Educators, Counselors, and Therapists website at www.aasect.com. Most sex therapists will start by recommending specific techniques in the bedroom designed to interrupt momentum to give you space to recover before reaching orgasm. These techniques include maneuvers like the start-stop method. This is exactly what it sounds like. You pause when you're close, wait for the sensation to pass, and then start again, and you try to do this with differing levels of stimulation. Another option that works for a lot of men is the pause-squeeze technique. Much like the start-stop method, the pause-squeeze technique has you pause when you're close, pull out, and then gently squeeze just below the head of your penis for about 3 to 5 seconds. This reduces momentum to orgasm even more than the start-stop, since pressure to the glands directly dampens the ejaculatory reflex. Think of it like tapping the brakes so you don't speed through a red light. Sex therapy with a professional can also help address anxiety or performance pressure, which are often major factors in PE. Our second option is topical desensitization sprays like Promescent or KY Duration. These sprays lightly numb the penis, lowering sensitivity just enough to last longer. This one is kind of like turning down the volume without hitting mute completely. Just make sure to apply it early, wait about 10 minutes, and then wipe away the excess. Otherwise, my friend maybe told me it has a soapy taste, and nobody wants that surprise. And remember, topical sprays take practice. Try it on your own before trying it with your partner, and don't get too discouraged if you miss the mark on the first time. If at first you don't succeed, try again. Now on to third-line therapy, medications known as SSRIs and one particular non-SSRI antidepressant. These types of options can typically be broken down into 3 subcategories. The first is daily SSRIs. So as you probably know, these medications are antidepressants, but as a side effect, they can significantly extend time before ejaculation. Most men see latency triple after just 2 to 3 weeks of daily therapy. Options in the US where we practice include paroxetine, which is Paxil, sertraline or Zoloft, and fluoxetine, which is Prozac. The second subcategory of oral antidepressant therapy to delay orgasm is on-demand SSRIs. A lot of patients prefer this because it's not a daily medication. Typically, most men will take these medications 4 to 6 hours before sex, which admittedly does require some planning. It's worth noting that this strategy typically isn't as effective as daily dosing as well. Common options here include paroxetine 20 milligrams as needed or sertraline 50 to 100 milligrams as needed. The third subcategory of treatment is on-demand clomipramine. Although technically a tricyclic antidepressant and not an SSRI, it's the most potent serotonin reuptake blocker we have, which can make it a better option as needed. This is commonly prescribed as 25 to 50 milligrams 3 to 6 hours before sex. Now, the ideal medication for premature ejaculation is actually a drug known as duloxetine, which is specifically made for PE, but sadly not FDA approved in the United States. Fourth, alpha blockers or prostate medications like tamsulosin, otherwise known as Flomax. Consider this one more of an honorable mention than anything else. The AUA guidelines do mention alpha blockers for PE, so we have to talk about them, but honestly, most men's health specialists, including us, aren't quite sold on their effectiveness. They are extremely safe, so there's no reason not to try, but talk to your provider if you haven't tried anything else, because there might just be better options. Fifth and final option is oral tramadol. Yes, tramadol is a mild narcotic, but it does significantly delay ejaculation. But due to potential dependency, sedation, and decreasing efficacy over time, this one's saved as a last resort, like very last resort. Always discuss risks thoroughly with your provider before going for this one. Now, the bonus tip you stuck around for, daily tadalafil. Have you noticed a pattern? Daily tadalafil can be a good bonus in a lot of situations. Daily tadalafil does not specifically delay ejaculation itself, but it does improve erections, boosts confidence, and reduces anxiety, key factors that help delay ejaculation. When things are running smoothly, your brain doesn't rush to hit the eject button quite so fast. Also, according to the AUA guidelines, if you have both ED and PE, treating the ED part of things first is essential. Tadalafil also reduces recovery time, known as the refractory period, so even if you finish quicker than you'd hope, you may not have to wait long for round 2. All right, so let's recap our top 5 ways to treat. Our first, sex therapy and techniques like start, stop, and pause squeeze. Second, numbing sprays. Number 3, SSRIs like paroxetine. Number 4, alpha blockers, but keep expectations realistic. And number 5, oral tramadol as a last resort. And that bonus tip, consider asking your provider to add daily tadalafil to keep things working as hard as possible. We want to hear from you. Which of these treatments surprised you the most, or if you've tried any, share your experiences down below in the comments. If you found this video helpful, give us a thumbs up, subscribe to the channel, and click the notification bell to stay updated with the latest men's health info. Thanks for watching, stay confident, have fun, and we'll see you next time.